Hi, dear distinguished audience. I am Dr. Chula Vitana. Today I would like to discuss about the special EHR, cloud EHR known as MD Online, and how we develop this MD Online EHR program to benefit the Sri Lankan current EHR system. First, let me introduce ourselves. We are a group of Sri Lankan physicians and scientists specializing in healthcare informatics in the United States. We have managed to build a Sri Lanka's national cloud EHR system with especially our group member Mr. Dilip Jayasekara and his IT team backing, and the MD online system depicted here is currently operational, and we believe that it will be the ideal candidate cloud EHR system which would solve all the problems currently existing in Sri Lanka. The MD Online, I would like to name it as a cloud EHR system with the power of an application as well as paper QR code outlining here is a comprehensive unified solution to the currently fragmented Sri Lankan's EHR system which are existing in private hospitals as well as government sector, with many types of non-communicative EHR system, therefore creating a difficulty in communication with each and every segment of the government as well as private sector due to its non-communicative barrier. We believe this is a fantastic solution to the healthcare reform and national digitalization initiative with several key features and benefits which I would like to discuss further. This initiative aligns with the global trend in healthcare digitalization and offer a unique opportunity to significantly improve the health and the well-being of Sri Lankan citizens while driving the economic growth. Here I am showing here the exact pictures of currently how the MD Online is working in America, and some of the pictures are directly taken from the website, and how the patient doctor interaction is taking place is clearly shown here. I would like to now discuss the core component of this EHR system, which is built by Dilip and his IT team. The core component of this EHR is extremely cost-effective cloud-based national EHR system. As explained here, it is known as MD Online. It's a simple design of paper-printed QR code that you see. It does not cost any cent, practically paper printed QR code, and it is also the application that is shown here. It is downloadable to any phone, any smartphone in every citizen of the country, and most families have 3-4 phones, and they can use the application to download free. The QR code this particular QR code allow doctor not only to read the valuable information about the patient, but also capable of writing the data into the MD Online cloud-based EHR, and the data is saved automatically when the doctor hit the save button. The QR code is the one which connect the MD Online. It provide the connectivity. By reading this, it take the take the doctor to the EHR directly. Fascinating thing about this system, this QR code, when it connects to the EHR system, it can be downloaded to the private computer of the doctor. It can be the computer, it can be also can be the phone itself, and this can be any doctor of the government sector who are working with hospitals, or it can be a DMO or MOH, or even a private hospital practice doctors. Say for an example, RCA hospital doctor can download it. It also can be rural hospital doctor who doesn't have a computer, but he can use it himself using the phone, and there will be a pop-up screen when the doctor connect with the EHR system, and in that pop-up window, doctor can see patient's all the valuable information which is required, including patient's name, patient's address, in the demographics, what are the essential things, including allergies, past history, also the lab data or x-rays, which are easily available with the previous most up-to-date progress note, so the doctor has fairly good understanding of patient history when the patient is shown. The major component that we find most useful is it is so robust to the doctor, and it is projecting into the screen. This will eliminate the major barriers having to use extremely expensive computer hardwares and massive consumption of electricity using the hardware by every doctor in the country, and also remove the barrier between the private sector as well as the government sector, while also eliminate the rural and urban divide of the healthcare, because it can be accessible from every place of the country, whether it is a rural community or urban community. Most importantly, it removes the Wi-Fi connectivity issue, which is a great issue in rural areas, and everything can be done through the cell phone or a tablet, which can be tethered to the phone. Therefore, connectivity is always established. The paper printed QR code, the simplest but the brilliant idea, where the QR code can be scanned from the doctor's phone, the provider's phone, which allowed direct access to the MD online EHR, and the doctor get simple window pop-up screen with the patient most essential data as I described before. And you can visit this website, or even now MD online website, to get the further detail. Now this is the screenshot I am showing how it is operational. When you go to the MD online, it has the welcome to MD online comes up. It provides the doctor to get a direct access with the email and the password. This is from the doctor's side when he reach. Opposite happen when the patient is coming into it. Patient also gets signed up similarly, and he can enter the system. Mostly the doctor is the one driving the system, so he can connect with the patient, as I am going to explain now. So what happened is that when the patient and the doctor is connected, it provides the easy access from any device for the doctor. It can be the phone, or as depicted here, it can be the computer, and the pop-up system will come up as the EMR in that subcategory, democratic category, or the subjective objective system. Patient diagnosis and the medication is allowed. And this is exactly taken from the website currently existing. It is extremely easy access through any device. The data is always held in the MD online. The cloud EHR system is updated when the patient come back to see the same doctor or it can be a different doctor who lives in another city, and the new information gets regularly updated automatically when save button is activated. When the Department of Health Ministry popularized this MD online application with the QR code, it can slowly but steadily connect every citizen of the country to be connected with the MD online. While MD Online also has this special module for doctors to get connected with the same EHR, which is known as MD Online Special Module, which connect every doctor in the country, which can be immediate since Health Ministry has all the data of all doctors in Sri Lanka. So, as I showed you the prior picture, the doctor can connect it with previous one I'm going to show you again. Doctor will be signing back on this MD online system, and he can connect directly in this way to our EHR system. So similarly, when the doctors are connected, patient side, patients can see who are the doctors who are available online at this time. Say for an example, it can show the how many doctors willing to see patients in Asiri hospital, shall we say. Patient can super select whoever the doctor that patient want to be seen. All entire country doctors will be online on this system, and patient can select wherever the place that the patient is residing to see the doctor. It can be a specialist, or it can be the primary care doctor who's available to see the patient. And this saves time, because without wasting time, patient can immediately see the patient. All that is done from this simple QR code, which patient can carry in a wallet as a paper, or patient can directly go with the application for connectivity. If the granddaughter or mother of the patient's granddaughter or grandson can be helpful in getting to the system using the application. But mostly doctor himself can drive this entire system. Now this is how it happened. I'm depicting here, patient is ready to see the patient. Patient is trying to connect with the doctor just by the phone. So now I'm going to discuss the key features of the proposed system. It is obviously the cloud-based national EHR system. System is designed as a hybrid model. Primary cloud-based 90% with some hardware computing about 10%, emphasizing the cost effectiveness. This aims to create a unified digital healthcare delivery system across the entire country, connecting both the private sector as well as the government sector. MD Online can be downloaded to the patient phone, like as shown here, as an application, or one can use the QR paper code. This QR code is the central element intended to be universally given to every adult senior citizen of the country free of charge. Since it is just a printed paper, younger people will be asked to download the application on their phone, which is also free. They are strongly encrypted for security and strongly built with 21st century technology security prevent the data theft. In addition, security and safety are enhanced with the biometric authentication, which we are planning to do later, but we find that without spending much money at all, we can have the maximum security. This paper can be used by the CHW volunteer who are somewhat computer savvy. They can download the application instead, and it can serve as the collaborative groundbreaking doctor and patient empowering tool without being antagonist to the current e-card system existing in the country. It will be rapidly creating a national EHR system, since every citizen of the country began to use it. It is integrating the Sri Lankan community-oriented primary care model, which is in the in the operational in the Jaffna University and Molathiv area. Many areas are operational. This will be the missing component for them to digitalize this same community-oriented primary care, which is specially designed to treat the non-communicable disease. The master plan, if I were to explain, this will be three types of integrational system with existing current system to mutually get integrated. Proposal emphasizes the integration with current systems such as the Hospital Health Information Management System known as HHIMS. Therefore, the system will be operational with collaboration with the current our EHR system as a cloud base, and then the HHIS system will be integrated in the same manner that I explained to you. In additionally, because of the HL7 and FHIR interoperability technology inbuilt to the MD Online, it will provide the maximal interoperability between the two systems. This system is already functional. It will enable the connectivity with the health, with the hospital information management system, as well as all private sector hospitals. In addition, we will be connecting with the outpatient government clinic management, and it will be supported for all the outpatient clinics of HMO areas, DMO areas and MOH areas, and all the clinics. We can install this very rapidly. It will be connecting with all private hospital clinics and in-hospital management in every part of the country where private hospitals are existing. This will, in fact, reduce the waiting time and quality care, linking the outpatient and inpatient services together. This also will be an ideal solution for the public health and preventive health model, expansion of community health worker program as discussed before in rural areas. Our QR code complement perfectly to integrating with the Sri Lankan community-oriented primary care COPC as described, and we will be integrating that also into the master plan. This will be an ideal solution for the management of non-communicable disease while bridging the gap between the prevention through public health and rural health. Due to its robust security and privacy, this system will be far more ideal than the currently existing system in Sri Lanka. And secure authentication protocol with pins and biometric multiple level password with granular consent option given to each and every level of extended care providers, and the compliance with the international standard and local data sovereignty laws. Our system will be most powerful, robust security and privacy system. It also given the patient-centric control to the patient. Patients are intended to have a comprehensive access to control over their health information. It is also doctor empowering system because it is designed aimed to doctor friendly while flexible configuration and potentially special rewarding mechanism to address the inertia and resistance. It also supports the community healthcare worker which are currently active in Sri Lanka. This proposal involves empowering CHWs, particularly in especially rural areas, by providing them with digital tools and comprehensive training to expand the health reach. And it is the ideal solution addressing the rural healthcare challenges. And we will be featuring with video telemedicine, mobile healthcare vans, and wearable technology as proposed to bridge the rural-urban divide. This is a good example how it can be conducted from the doctor's desktop, and he can have direct communication with the patient, empowering doctor-patient connectivity remotely, to implement the program. It also has a connectivity to the laboratory, which will be coming soon. We are just building this component, and it will connect to the laboratory, and from the venipuncture level for the laboratory to ultimately lab results all get uploaded from the same QR code. The most simplest thing but most effective thing here is the QR code is also printed in every lab data that laboratory is printing out, because they follow with the same QR code, and the filing of the labs will be very easy for any system, because the same QR code will be tagged to the every lab, every x-rays and every other investigation, which we think is the most ideal way of doing the comprehensive treatment support just through a simple QR code. This is the connectivity of the pharmacy. This is also coming soon in collaboration with Dr. Kumara. We will be having similar system for pharmacists who are not regularly present, have a system so that we can have tagging system for the same bottle which have the QR code once printed, so we know exactly how much medicine is given, compliance of the patient, pharmacy participation actually make a great power to the system, and this is already will be embedded and it will be coming soon to the system. This is how the contact system is maintained. Patient first, when the patient want to contact, patient put the first name, the email, subject, what is the message. This send the message to the primary care doctor. It can be the pharmacist. It can be communication between the lab. Any kind of communication can be sent like a message. So the system is so simplified. It is only two-step process to connect with the doctor. First is the sign up. It is very easy to sign up. Just fill out the quick sign up form, and it could be applied to any disease also. If you were to be if rapid recurrence of COVID epidemic happened, this can be ideal solution to treat them. And then patient has the ability to choose who the expert is. Since the doctors are already in the system, they can select exactly which doctor to select, and the doctor-patient communication taking place beautifully as depicted in this picture. And it's very simplified. There is no complication at all. The last but least, I have taken an example for the group to understand. I am testing the camera. This is my picture. Patient can test the camera is working or not very simply clicking on that. Just the way I click, my picture went to the camera. Patient can check the mic can be tested, and patient and the doctor is very easily connected. So in other words, in summary, what I see is that this very simple method will be the most cost-effective method for us to implement the EHR in Sri Lanka while without wasting too much money, and most rapid manner we can build the system. This is again that I'm showing how many doctors. This can be entire population of Sri Lankan doctors, and they click and select whoever they want, and they connect with the MD online. And we find this is the most ideal solution to get the current EHR system to become interoperable without reinventing anything, without destroying anything, while keeping the current system of current government system as well as private system. We can rapidly digitalize the system. Can I thank you for listening?